So you walk into the office with knee pain and your doctor gets an x-ray and then they say that you have arthritis. Then they immediately reach out for a cortisone injection and they say it's quick, it's fast, it's a gold standard. But what if that quick fix is actually making your knee age faster? I'm Dr. Sri, I'm a board certified family medicine, sports medicine and integrative medicine physician. And in this video, we're going to talk about Cortisone Dilemma and why your next injection might be doing more harm than good. So first, let's talk about the x-ray trap. So doctors use a scale to grade arthritis anywhere between 1 to 4. But the research shows a massive disconnect between the x-ray images and the patient's symptoms. In my clinical practice, I see a lot of this inconsistencies all the time. For example, I'll see a patient with severe pain, but the x-ray only shows mild arthritis. Then I'll see a patient with severe bone-on-bone knee arthritis and they feel completely fine. Why? Because pain often comes from things an x-ray can't see, like inflammation in the joint lining or bone marrow lesions, which are essentially bruises inside the bone. If I'm only treating the picture, then I'm missing the real problem. For decades, we thought cortisone injection was harmless, but in 2017, a landmark study in JAMA changed everything. They followed 140 patients for 2 years. Half got a steroid shot every 3 months. The other half got a simple saline injection. So the steroid group lost twice as much cartilage when you compare to the saline injections. And again, this was an extreme study where the patients were getting injections every 3 months, irrespective of the symptoms, which is not how we practice in real world. But still, this points out that cortisone injections can be chondrotoxic, which is basically a fancy way of saying that it destroys your cartilage cells. So think of cortisone as a molecular band-aid. It feels great for a few weeks because it numbs the inflammation, but may also thin your meniscus, the natural shock absorber in your knee. By masking the pain, you might overuse a joint that is structurally failing. You're ignoring the foundation, your muscles. So large observation studies using data from Osteoarthritis Initiative have shown that people who get frequent cortisone injections do have increased risk of osteoarthritis progression, thereby increasing risk for total knee replacement earlier. But the problem here is that it's very likely that the patients who get these injections are probably in a lot of pain and a lot of inflammation, that they're predestined to have a total knee replacement sooner, and these cortisone injections probably may not be playing any role. But it's also very hard to ignore the fact, especially from a JAMA study, that there is a chance that the cortisone injection still might be playing a role by damaging the cartilage cells, thereby increasing the risk for total knee replacement earlier. I don't want to sound like an alarmist. I don't think that one injection is going to destroy the joint that one is going to get a total knee replacement sooner. For example, there are patients who come with severe arthritis flare-up where they have swollen knees, painful knees, they're not able to walk. And during these times, the steroid injections can be pretty much life-changing. They break the vicious cycle of inflammation, and thereby it helps them to start focusing on the other pillars of knee health, which is basically physical therapy and movement. So I still think the cortisone injection still has a place. However, I encourage you to pause and ask these questions before your next injection. Is my pain truly severe and unmanageable? Have I exhausted exercise therapy and lifestyle changes? Could an alternative like platelet-rich plasma injection or hyaluronic acid injection be a safer choice for my long-term joint health? So remember, your knees have to carry you for a lifetime. So don't trade long-term joint mobility for a short-term fix. Okay? I hope this video was helpful. If you have any questions or comments, please post in the comment box below. If you want to get started with knee osteoarthritis home strengthening program, then check out this video here. If you want to know whether you should consider platelet-rich plasma injection or hyaluronic acid injection for your knee osteoarthritis, then check out this video here. And I'll see you in the next video. Until then, goodbye.